Through cross-departmental cooperation among the medical department, Department of Laboratory Medicine, Nursing Department, Information Technology Department and etc., the closed-loop blood transfusion management system of Changhua Christian Hospital has been established, including prescribing orders, sample collection, pre-transfusion testing, blood issuing, transportation, receive and verify, identification and transfusion, monitor and report, to provide safe blood transfusion services. Prescribing orders. When physicians prescribing orders through the electronic prescribing system, the history of patients' adverse transfusion reactions will be shown and blood transfusion records which are completed within 24 hours. Physicians can check patients' related blood lab tests through e-prescribing system. Once physicians click the lab data, the e-prescribing system will import patients' indications to orders. The nurse confirms physician's order, patient's indications for transfusion and a valid signature consent. Sample collection. The nurse logs in the blood transfusion preparation system to verify the patient's full name and the date of birth, then scans patient's wristband for the verification. After identification, the blood transfusion preparation system will show the patient's information, blood type, blood product as ordered and indications. Two nurses will simultaneously verify patient's information shown on the computer screen, including medical record number, patient's full name, date of birth and blood type. Once the verification is done, both of the nurse's employee ID will be scanned to the system for the record. Print out the label and attach to the test tube before obtaining the blood sample. Once the blood sample is collected in the tube, the barcode of the lab tube will be scanned and saved as for specimen transportation system. The blood sample will be delivered to blood bank by pneumatic tube system. Pre-transfusion testing. After receiving the pre-transfusion testing specimen, lab assistant scan the barcode on the sample tube for registration. The blood issuing request from nurse can be transferred and received by the medical technologist via blood bank system. The blood type and antibody screening tests are analyzed by the automatic blood bank analyzer. After the tests completed, the reports can be loaded into the blood bank system via electronic transmission. Before performing cross-match testing, the medical technologist identify the specimen by scanning the barcode of the specimen. When the specimen identification is incorrect, the system will display a pop-up window for warning. After the compatibility testing completed, the number of the compatible blood bags were recorded into the blood bank system by scanning the barcode of the blood bag. Blood issuing. When the medical technologist scanning the barcode on the blood bags, a label with patient's identifiers will be printed automatically. After sticking the label on the blood bags, then the blood bags can be issued. When the barcode on the blood bags scanned is not compatible with the patient, the system will display a pop-up window for warning. Transportation. Before delivering the blood bag, the staff is asked to scan the barcode of blood bag and the employee ID to record the transportation of blood bags. The staffs of blood bank can monitor and manage the movement of blood products by using blood products tracking system. Receive and verify. The nurse who receives the blood product will scan both the barcode of the blood product and his or her ID as for specimen transportation system. Identification and transfusion. Two nurses verify the physician's order, blood products, patient's full name, medical record number, date of birth, blood units, intended date of use and the lab results. The nurse informs the patient about to start the blood transfusion. Two nurses at bedside verify patient's wristband, including patient's full name, medical record number, date of birth, and blood type, blood expiration date. The nurse logs into the patient transfusion identity verification system and scans the patient's wristband in order to read the patient's information. Read the barcode labeled on blood product. Confirm if any patient requirement or condition for blood product is written in memo. If the blood product is not intended for the patient, error pop-up. The signal of warning will appear on the computer screen. The two nurses scan their employee ID, press the button of Start Blood Transfusion on the system, and obtain pre-transfusion vital signs. The nurses educate patient signs and symptoms of blood transfusion reaction and inform him or her that adverse reactions may occur. The nursing information system will remind the nurse to monitor patient for adverse reactions during transfusion. Monitor and report. Once the blood transfusion is completed, the nurse will document the transfusion completion time and report blood transfusion reaction on the system. For patients with adverse transfusion reactions, the physician can check the reports of transfusion reaction investigation from laboratory reporting system.